so we're going to get started. This is Empower Hour Live. It is Friday, September 24th, and we are about to get empowered with Laura, our rep from GO365 Humana. Please correct me if I say that. Before we get started, though, we were talking a little bit about you. So let's talk about you more. Who are you, Laura? Where did you come from? And what's your path to this day?
Yeah, absolutely. Well, I just want to say thank you, everybody, for bringing me in to speak today at the Empower Hour. I am Georgia born and raised. I went to the University of Georgia, where I studied health promotion and education. So a lot of people always ask, well, what is public health? What does that even mean? Basically, it's where, I work with communities through Humana. I work with employer groups like yourself. I've worked with older adults. I've worked with children, but I found, go dogs, absolutely. I actually was studying microbiology at UGA, and I just didn't vibe with the people. And I finally found my culture, my people, and the health promotion and education. It's, we're usually caregivers. We have givers' hearts, really passionate about, the people that we interact with every day. My grandfather had gotten really ill and passed when I was in college, and he had colorectal cancer. So I think all of us, unfortunately, have probably had a loved one or were affected by, someone who was taken from us. But in our situation, he, had bad eating habits. He was also a Georgia boy, and he ate the same red meat meal every night. And I remember thinking, and he didn't get his colorectal cancer screening. And, it was too late by the time that they had discovered what had happened. So that's kind of where my heart comes from. I'm very big on preventive care, and GO365, one of the huge components of our program is preventive care screenings. You earn points for getting those, and get rewarded. So so that's a little bit of kind of how I got into this field. I actually, one of my boss who ended up hiring me with Humana also went through the same exact program at UGA that I went through. And so I found this job through an email from my old college professor. Applied. I thought it had my name written on the job description, and I've been doing this for 7.5 years, and I love it so much. The job has changed and grown with me over time. So, like I said, I get to work with employer groups. I help educate you guys about what is the program, how can you use it to meet your individual needs, which is one of my favorite parts of the program. Personally, in 7.5 years, I've gone from being, 20s to 30s and had a baby, and I have a chronic health condition. I have rheumatoid arthritis. So I have to do certain exercises. I can't do high intensity because that hurts my joints. So, I have maintenance medications and go to my preventive care and kind of find the right exercises for me. And also, really big component for me is focusing on your mental health and wellness, especially what with the pandemic. I think all of us need a little self-love. So
at one point I was going, I'm sorry.
Go ahead. I was going to say, so I love the program because it kind of touches all those things.
All of these things. Yeah, that's one of the things is that it's a wellness program. That's how, we get to use this as a wellness program. But I know for me personally, you're like the mental health aspect. I think at one point this past year, I had an issue, but I was seeing, I had an accident that left me a little shaken, and I was going to 3 different types of therapies because I was like, I've got to get past this. So yeah, I am a huge advocate for wellness and mental health as well. So I'm super glad that we could have you on. Thank you for taking the time out of your schedule to be here to inform us on how this works for us. So I'm very excited to get to do this. We hear GO365 at our company all the time, but sometimes we don't know what that means. It just seems like another thing that, we offer that's just like, oh, it's something to pass off. But this actually puts your wellness back in your hands and lets you receive, lets you reward yourself for caring for yourself. So I love this. So
yes. Absolutely. Yeah, you can use it at your own speed. You can really use it for so many different things. So as I kind of talk about the program, I hope all of you think, okay, well, maybe that part might not be for me, but I could do that. That will fit in maybe with my everyday life, or maybe I could just make little changes. And that's what it's about, is lasting behavior change. If you want to, if you want to manage a chronic condition, or if you just want to track steps and get gift cards in the mall, it's something for everybody.
Well, the first things first, I want to get started on this. So again, thank you for being here. But the first things first is, what the heck is GO365? You take us there, and why is it so hard to sign up?
Yeah, no kidding. That's actually what I'm going to start with. And if you don't mind, I'm going to share my screen because I put together a presentation. I am a visual learner.
I love it.
So I put together something for you guys just so you can kind of follow along.
And if you're watching this and have any questions at any point, please feel free to put them in the chat. I will ask Laura. Laura can see it. She will answer your questions. We'll have a little room at the end to answer questions too. But if anytime you have a question, just plop that in the chat there.
Yes, I'll make sure I answer all questions. And the good thing is I'm a resource moving forward. So if for whatever reason the question doesn't get answered today, or you come up with a question as you use the program moving forward, you've got resources, and I'll touch on resources as well.
Ready, set, go 365.
Yes, absolutely. You've read the marketing materials. We already talked about myself, so I won't go over that anymore. Again, just thank you guys for letting me be here today. The GO365 program, you guys have it as a standalone wellness program that's tied to your current benefits package. So again, it's really just something bonus for you guys to use and hopefully get rewarded for it. So it is an incentive-based program, our wellness and rewards program. High level, you participate in wellness-related activities and you earn points, and those points become redeemable in our online GO365 shopping mall. So additionally, this is kind of what the program looks like. So this is my favorite visual of what the program is. Everybody's going to start out at a blue status level. You eventually complete activities. So notice there's no amount of points that you need to move from that blue to the bronze status level. There are 3 activities that you can complete to get out of that blue status level. So we'll talk about all 3 of those in a little bit more detail. So you get up to bronze status. That means you've gotten started, you've taken the first step. Then you move up to silver, gold, platinum, complete various activities, earn points. You have all year long to earn points and increase your status level. So take your time. You don't need to rush to increase your status level. Your points will continue to accumulate as you go. So that is a good visual about how the program works. Before I get into the details, I like to talk about the rewards a bit.
Yeah.
Have you guys cashed in any rewards yet?
You got to ask Nicole Jolly. She is our, like I said, Hank sent a message, but it only came to us, host and panelists. But Nicole Jolly, if you could chat how many points you have right now, because we want to know if people can catch you. She is,
Exactly. Well, oh, yes, I have. She says she's definitely cashed in Amazon and REI. Thank you for sharing. I love getting the feedback from you guys because Amazon is also my personal favorite because I am really bad. I am a spender, not a saver. I try to wait until Christmas every year. Doesn't usually happen.
Not when you're in
But we actually, due to the pandemic, we realized that sometimes people just needed help paying their bills or for anything. So I'm proud that GO365 added in Visa and American Express gift cards, as well as we are continuing to partner with a lot of charitable organizations. Feeding America is one that is one of our main partners. I'll talk about those guys when it comes to the National Step Challenge that I hope everyone will join. But so we have a lot of great items in there too. So Amazon, a lot of e-gift cards, and we just added in a lot of retail places, a lot of restaurants, that sort of thing. Fitness devices are common as well. because you can use your fitness device to help earn more points. So it's always nice to kind of use your points and bucks, cash in for something that can help you continue to earn. The main questions that I get about the rewards are, if I spend my bucks, does that impact my status level? Because you want to increase your status level, not only for bragging rights, you get up at platinum status and you're at the top of the threshold there, but we give you bonus bucks. So more money in your personal bank account for hitting those additional thresholds. So you see here, once you hit certain status levels, we'll just put bonus dollars. The way that the dollars work is, let's say you get to platinum status and we give you those 5,000 bonus bucks. That is not $5,000. We're sorry, but it's equivalent of 50. It's the equivalent of $50. You can earn up to $300 or 30,000 bucks.
Okay.
If you spend your bucks in the mall, it does not impact your status or your point threshold. So think of it as earning points. Points turn into bucks, and the bucks are what you cash in.
Okay, that makes sense.
My account always has more points, less bucks. So those will be different numbers usually.
Yeah, because we know you have a shopping habit.
Yeah, I really well, now I just shop a lot for our daughter because she's growing like a weed, and everything is cute for babies. So moms don't get a chance, honestly. But
I'll never know.
Yeah.
I can never be a mom. Anyway, that's a side note.
Yeah, that's another part of managing my health, is not trying to keep my health on the front while I'm wrangling her. So that's kind of how the rewards work out. I didn't want to go on without talking about the rewards that aren't financial. Well, could be financial. And does GO365 actually work for what we really set out to do, which is improve lifestyle related risk factors and your clinical risk factors. So your lifestyle related risk factors are, the program's helped me to improve my nutrition habits or my exercise habits, or I've quit smoking, or I'm managing my chronic condition. If we're talking about clinical factors, I've improved, I've lowered my A1C or my blood pressure, I hit my weight loss goal, those sorts of things. Additionally, I showed you the status levels because I wanted to point out that our members who hit silver, gold, or platinum status, especially gold or platinum, we're seeing decreased healthcare claims costs. So things like being a more knowledgeable user of your benefits, being more thoughtful. So having the wherewithal to say, this is a telemedicine thing. I can do the doctor on demand, or I can FaceTime a physician, as opposed to going to the ER or urgent care, or maybe I go to urgent care instead of ER, something like that. So,
or in the case of Nicole in our chat to us, she said it works because it got me to the dentist for the first time in 8 years. So even,
Exactly. You get points just for going to the dentist. Exactly. So, yeah. And I love hearing that because, like I said, I love the preventive care component. So that's what this is really about. The rewards are fantastic, but this is why I do what I do. I want to, if I can have one conversation with a member who says, wow, I hit my weight loss goal, or, I got my mammogram or something. I mean, this is about you guys taking care of yourselves, preventive, trying to get that preventive care. Hope if we do discover something. I mean, I've had members who, this usually doesn't happen, but they go get their health screening just for the points and find out they had, really high blood pressure. I had one member who found out they actually had brain cancer because they went to their doctor for a health screening, and luckily that member is okay. They found it early, but just to get points with the program. So that's what, there are so many benefits to just putting your health, taking care of yourself. I know it's hard, especially being an employee working, take care of yourself. We want you around for the long haul.
My last thought as I was falling asleep last night was, because I was thinking about today I would talk with you. So my last thought right before I fell asleep was, I really need to like get my like annual checkup. Like I just need to go like do that, and I can turn it into points if I do that, right? Yeah.
Yes, you
Okay.
can.
So,
Yep.
but I just, yeah, I need that preventative instead of like being anxious all the time. Oh my God, what is going on with my body? Like, just go find out.
Yeah, well, and I'll tell you, those are extreme examples I just mentioned. 9 out of 10 times I have members who everything's fine. Maybe they didn't realize something was a little elevated, but overall their results are great. So it gives you a little peace of mind. And if there is something you need to work on, you can start working on it. We want to encourage that for sure. So I'm glad you had that epiphany. Go get that screening.
Jennifer asks in the chat, how do we submit when we go get that checkup? Are you going to go over that? Is that?
Well, yeah, let's continue moving forward because I'll
Okay.
definitely talk about how to submit that. So I know that sometimes just getting in is the biggest issue.
This is.
So I put screenshots. I'll go through them pretty quickly, but I just wanted to show you guys. So 2 ways to access our program. We have a GO365 mobile app, and we also have an online presence. I highly recommend going to go365.com to register as a new member, or if you've forgotten your login information. You are going to activate your online profile if you have not registered before. So just click on that blue button there and then moving along.
And you need your member ID.
Have your member ID number ready.
Do people receive cards?
Yeah, yes. So you should have, when you guys first came on with us, received a GO365 member ID card, just like your medical benefits card, but it'll be, have the GO365 logo. You can request another one if you sent out. And a lot of the times they come in a nondescript white envelope. It's not, sometimes it just gets thrown out because it's pretty nondescript. So if you need to know what that ID number is, you can always, I highlighted over the get help. I didn't just do this for you guys. I had one group who was just having a time getting registered. So I very specifically highlighted where you can talk to a customer support representative. So you see here at any time, if you are having trouble with the registration process, tap on the get help. It'll give you some tips, or you can get the GO365 customer support phone number. So you see the contact us button right there.
So if we didn't receive a card, because we have a few people saying in the chat that they didn't receive one, and I think I threw mine away, don't shoot me, but we can request a new card through this website as well.
Yeah, or call customer support too. You can always, I was just gonna say call the number on the back of your card, but if you don't have a card then. Yeah, and I'm going to leave you guys the numbers for customer support as well. So they're a fantastic team. They do such a great job for us. So definitely call them if you're having any issues with anything.
Okay, great.
You can also use your social security number to register. So for a temporary amount of time, it was member ID number only. Myself and others complained about that because social security number has always been a part, just because we all know that number by heart. So if you don't have that card handy, they added it back in. So you could use a social security number. You're going to key in your date of birth and your home zip code. And we are going to confirm it's you with that information. And then you're going to just key in your email, because we need to have an email on file. It is a technology-based program. So just key in your email address, create a username and password. And then I just want to go over the 2-factor authentication. So we want to confirm it's you with either text or email. You could do both if you wanted. So, choose whichever you would want. You're going to be prompted to enter in that email address or cell phone number. Just submit it. You'll get a code sent to your email or phone text right away. And enter in that code. You can, like I said, go on, and if you do email and you also want to add text, you can do that. And you can also choose which one is your preferred security method. So if for some reason you forget your login information, I like to take the time to go over that, just because I know sometimes just getting in is the most difficult part. So we are not a technology company, we are an insurance company, but we are working on it. We have a great IT team as well.
And it sounds like it only takes like 2 to 3 minutes in all to do this. You just need the right information. So,
Oh yeah, exactly. And with the add-in of the social security number back in, that's all information you should know by heart.
Right. And
Then you're
boom,
registered.
and
You
you're
can access
in.
the program. So hopefully you're in. And so now we're gonna just show you
Wait,
the website.
so can we go back for 1 second? Because I just want to tell everybody, make note of your username. I highly recommend highlighting that because I don't know my username. I've been having issues. I'm sorry, Laura. I've been having issues all week trying to remember how to log back in because I don't remember my member ID. I don't know what my username is. I don't know which email I used. So
Yeah.
y'all be smart about it.
Please write down your credentials, please.
Yeah.
No, yes, thank you for saying that.
Hmm.
Well, hopefully you are able to eventually get in, and this is just a screenshot of what your homepage will look like. So I want you to make note of the top of the banner here, the blue banner. It says activities. That is going to be where you're going to go online to submit activities.
So 1 second, because Paula asked, how does she get in if she doesn't have the Humana insurance? We don't have Humana insurance. We have just only GO365 as the wellness option. So Paula, we are working on in the back house today, right now, as we speak on this call, we are uploading all new employees with the changes of HR switching hands and just a few people leaving. There was a bit of a ball drop there, but we are picking it up and everybody should receive that. She could not log in. Then you need to contact that customer service and they'll be able to help you there. So sorry,
yeah,
Laura. Thank you.
I'll make sure you guys have those customer support numbers. But yes, so we do have Humana insurance, right? So some members, it might prompt you to go through humana.com, but you guys are only GO365 users, not Humana. So make sure you're going to GO365.com to register, because you won't be recognized on the Humana site, obviously, if you don't have the Humana medical coverage. This is what your homepage will look like once you get logged in, hopefully. The activities button is going to be a common place you're going to go. For example, submitting a dental exam, you just need some sort of slip from the dentist that says you went, and you just upload that activity online. We do require some sort of proof because, well, frankly, it's a rewards program and we give out a lot of rewards every year. And we just want to confirm that you guys are participating so that when I sit here and talk about in 5 years, what have we learned and what's really working, those numbers are based on verified data. So if I'm moving on this page, I tapped on the account button. So you see your blue banner remains no matter where you go on the website. I just wanted to highlight the account button, and then you would tap on quick links. Quick links will take you to other great resources here. Connect and manage your fitness devices, participating fitness facilities, access to challenges, track your daily workouts, frequently asked questions, and forms. So if you are going to the dentist and you want to just take our already approved form, you could do that. I'm going to pretend like we just clicked on participating fitness facilities, and here is what you will see. So right off the bat, you'll notice that we've added in a lot of virtual fitness facilities. That was something we added in due to members not going out and to actual facilities. So we are constantly adding in new virtual fitness facilities. So check that out. Or you could key in your zip code if you want to look up facilities nearby you that you're going to or attending.
So with these virtual fitness facilities, is it free because we partner with you, or is it like a discounted rate to use those?
Usually we do have discounted rates. Great question. So whether it's a virtual or a in-person fitness facility, a lot of the times we will have negotiated rates with those facilities, but not all of them. So that's something that you just choose what's going to be best for you. We do have free options as well. These are just the actual facilities, and I'll talk about those. Yeah, good question.
Thank you.
No, you're welcome.
We love a free thing, but we need to, you know, but we also will pay for it if we gotta, just gotta know.
I'll give you all your options. I'm definitely the free as well. I just wanted to quickly go over an example of how to submit an activity for points.
There, take note.
Some activities are only online, some are on the mobile app that you can upload, I should say. I'll go over some of those in a moment, but here's an example for a dental exam. It would be the same for flu shot, mammogram, pap smear, prostate exam. COVID vaccination is on the mobile app only. So that's the one that you can upload through the website. But you're just going to have some sort of proof. So you see here, it just needs to be some sort of record or certificate showing that you went. So I normally just, you know, take a photo of something on my smartphone and upload it whenever I get home. All you need to do is upload the file. Make sure you're submitting it within 90 days. So Humana is very big on submitting things within 90 days of completion. So if you've gotten your dental exam, vision exam, anything in the past 90 days, go ahead and upload it now. We have one caveat, and that is the COVID vaccination. A lot of members got that previously. If you have not uploaded your COVID vaccination, upload it today. So if you need to get in, we added COVID vaccination as a way to earn points 90 days ago. Today is the 90th day. So we waived that. We have to use your form for dental. So good question. So real quick with the COVID vaccination, upload your COVID vaccination today. You can do that on the GO365 mobile app.
You just like you met your card that you got?
Oh yeah, super simple. You would just a copy of your vaccination card is perfect. Cool. Yep.
Can you upload multiple things a day?
If we go to the doctors and then the gym, yes. So you can upload multiple activities a day. If it comes to workouts, you can only upload one workout per day. So let's say I go to the gym and I get 10 points for going to the gym. However, I'm wearing my activity tracker and it's counting my steps or something else, but I track steps. So I'll use that example. Let's say I walk 20,000 steps in the day. Well, I'll get 20 points because of my 20,000 steps. So the program will only give me one of those a day, but they'll always award me what's the highest. So I'll get 20 points. So I won't get the combined, but I will get the 20. Good question. And I just wanted to, I saw Lisbeth ask, do you have to use your form for the dental exams? You do not. So we have our own PDFs online that you can access and download and take with you on your visits. Otherwise, you can you can submit your own form of proof. So it does not have to be our exact example.
Okay, and then Jen wants to know, which major fitness trackers do you use, or which ones are accepted, or is it just Fitbit? It's not just Fitbit.
It's not just Fitbit. We have a lot of partnered Fitbit's one of them. We're partnered with Garmin. The Apple Watch question, I am an Apple Watch wearer. You're going to connect through your Apple Health app. So if you are a Samsung Health user with Samsung Health watches, or you're an Apple Health user with an Apple Watch, you're going to go into your GO365 mobile app, and you're going to go to connect and manage devices. You'll see the icon and it'll say Apple Health, Samsung Health. You'll just make a one-time connection between your fitness device. Same thing with like Fitbit or Garmin or your gym. You just make a one-time connection and then you're all set moving forward. And it'll tell you confirmed fitness devices. So you'll be able to see on your kind of readout on your screen if the connection was successful or not.
And Nicole says, when is the Apple Watch going to become compatible with calories burned, girl? Right now it's just steps.
I know, I agree, Nicole. Right now we only do steps and sleep through the Apple Health, although it can do so much more. And we are constantly working to improve our program. So I know that they are working on that now. So stay tuned. And make sure you become a member of our GO365 community, because that is a member facing website that we put updates through all the time. So definitely, I'll show you where you can join the community and kind of keep an eye on anything coming through. How do you become a member of that? All you have to do is get onto the website. So I'll share that website with you guys.
Nicole,
Or
thank you.
go
You
into
should
your
be on this.
GO365 mobile app or website, and you can find the community link there as well.
I know, Nicole, sorry, I'm gonna speak straight to Nicole. She's gonna end up being like a sales rep for y'all or something, Laura. So you gotta be careful. Nicole's ready.
Which
She
is
can do
fine.
it.
Which is fine. We need passionate people. Oh, and I forgot. I'm so sorry. I forgot I did put in the screenshots.
She does CPM too much. I know, Nicole. I know. That's good, Nicole. I know. It was just a joke. If anybody's watching.
Happy to hear it. I'm so sorry. I forgot that I put in the example of how to submit the dental on the mobile app as well.
Okay.
So here is an example for an Apple phone, but if you have a Samsung Health or an Android phone, the hamburger icon, your 3 little dash marks, that's going to be where you go to submit activities. And again, this is where you'll go to submit your COVID vaccination as well. So this was an older screen grab. I'm just now realizing it doesn't show COVID on here, but you can submit the COVID vaccination same exact way. So you key in your date, and that's 300 points for the COVID vaccination, not just
if you have both, you have to have both shots for that, or just.
And upload it if you only have the one. I think we assume that hopefully
Okay.
you'll get the second dose.
Okay.
That's kind of a gray area. The web and mobile app differences. This is a question I get commonly. A lot of activities, like you saw, the dental exam, flu shot, vision exam, you can upload those through the mobile app or the website. One thing you can only do on the mobile app is the COVID vaccination. So submit that through the website. Health screenings. So if you're getting that annual physical or your health checkup, currently we can only get those through the website. And the reason being is, you heard me mention when we first started talking about the program is, if you've got some wellness goals, you want to, maybe lower your weight or maintain a healthy weight. The program uses your biometric screening results to appropriately recommend activities. So, legally, we're not going to recommend a lower your weight goal if we don't know what your starting weight is. So we just want to make sure that we're helping you in a healthy way. So, so the biometric data can currently only be uploaded online because you're going to input your actual results of your screening. And this is all private, by the way. Nobody has access to your portal but you. Your employer cannot see anything you're doing. I can't see anything you're doing. It's your private space where we recommend personal goals for you only. And you'll be the only person who knows what those are. So I have a lot of members who think, I don't consider myself healthy, so this isn't for me. I would beg to differ exactly the opposite. I have had so many members who work on their wellness goals with the program. Guess what? You're completing various health and wellness related activities and hitting goals. And we award a lot of points for when you hit your goals. So
they even got coaching on the app. So, it's like get coached.
We do.
Log your sleep. You have a sleep diary? You can diary while you sleep? That's insane.
We get you points just for getting enough sleep.
Wow.
Exactly. That's all comes from the
Ali said she could. Last night I would have got all the points. I had such an amazing night of sleep, 8 full hours. So, maybe I need a sleep diary today.
Well, just all you have to do is start it on your mobile app. Just go in through the mobile app and hit start a sleep goal. And things like weekly logs, easy things like parking further away in the parking lot or taking the dog on a walk, something like that. That I like to think of online as more like long-term goal setting. So if my goal is to lower my weight, get it to a target weight, I'm going to set that activity up online, but then I'm going to go to the mobile app and track my steps. I'll, do the park further away in the parking lot and get points for that. I'll participate in step challenges, that sort of thing. So I think of the mobile app as more like short-term little pick-me-up points and bucks, and online is more like the long-term goal setting. They both go hand in hand. So make sure you're checking out both.
Well, it just said I got locked out of my app. So customer service, I'm calling you.
Yeah, I was going to say, we just need to go right ahead to where I show you the customer service. The health assessment. you hear me talk about customizing GO365 to meet your individual needs. I highly recommend taking that health assessment questionnaire and the health screening, because those two things go hand in hand to allow our program to generate recommended activities that are customized based on your feedback. So the health assessment is the only place that you have an opportunity to give us feedback and tell us what you're looking for out of your wellness program. You can complete that on the mobile app or online. And again, it's completely confidential.
In less than 15 minutes. Doesn't take much of your time at all.
Yeah, it's really quick. Again, your results are confidential. You earn a lot of points for completing it. If you complete all 6 sections, you get bonus points. So go in there, take your health assessment. You will get your GO365 age. I'll be the first person to say my GO365 age is higher than my chronological age. And it's, again, it's just to educate you. This is to, I mean, this is Empower Hour. It's to empower you with that information, with that number. We'll explain why, you know, tobacco use, for example, will drive that number up. So it's just to help you kind of get a good mindset of where you're at.
Way to bring it back to the call. Thank you.
I'm a professional. You're welcome.
You know, you're killing it.
I'm kidding. Recommended activities. Again, this is my favorite part of the program, and these you need to access online. So take that health assessment, go on to go365.com, and we might have recommended activities for you. You see here, someone must have had a recommended activity around physical fitness. So all these, if you can read that small on your screen, you know, these are all fitness related suggestions. So we'll give you recommendations based on what your activities are. Biometric screenings, AKA your annual physicals. This is a huge point earner, and wow. I can't stress this enough that get your preventive care screenings. If you go through your medical coverage, it's free, it's preventive care. Please get your screenings, even if you don't use it for GO365 points. It's just so important to know what your numbers are. And I know I'm preaching to the choir here in my own home. I have to make my husband go get his health screening. So I know it's just easier said than done, but take some time and take care of yourself and get that health checkup. We're going to award you 2,000 points minimum for completing that biometric screening. So that's going to be your BMI or body mass index, which is a terrible number that we all hate, but that is going to be a combination of your height, weight, and waist circumference. 800 points just for getting that checked. Your blood glucose, cholesterol, and your blood pressure. So for the cholesterol and the glucose, there will be a blood draw required. So it's either going to be a finger stick or intravenous through a vein in your arm. So it just depends on what facility you're going to. Probably if you're going to your primary care doctor, they'll probably do intravenous blood draw. But it's okay. Just go get it done. We will give you up to 4,000 points based on those in-range numbers. So if any of your numbers are falling in what are considered our healthy ranges, you earn double the points. Wow. If you're out of range on some and in range on others, we'll let you pick up whatever was in a healthy range. And if you have anything out of range, maybe we'll help you set a recommended personalized activity, and then you can earn points for getting, you know, that weight lowered or whatever the goal was that you were working on.
Yeah, and also at EPM, outside of just the GO365 program, so you get your points within, we track the points, we pull a report weekly or monthly to see who has the most points, and the top 3 people with the most points receive a trip from EPM for participating. Yeah, so I think Nicole right now, Nicole is number 1. And I think, and then it's LA and Chris Miller. I think those are our top 3 right now, but they're going to get to go. I think it's like Hawaii, Key West, and it's just like amazing trips that they'll get to go on just for participating and for really taking advantage of this great wellness booster, as I'm reading on your screen. So
That's great. Yeah, no, I mean, things like this go to keeping your employees, feeling like, their health really matters. I think that's fantastic that you guys
So if
do.
you get this biometric screening and that's 2,000 points that you could get just for doing it, you're in the healthy ring, that's 4,000 points. So that immediately probably puts you in our top 25 of points here, because that's halfway to where Chris and, like, I think Nicole's got Nicole's untouchable, but she's got like 21,000 points or something.
She's not, I mean, I'm so glad that Nicole's doing great, but it's, if you guys just take the time to set up your account and kind of get started, the points will just start rolling in once
And
you
that's
get.
what she told me when I said, how did you do this? She was like, just do it. It's there.
Right, just get started. Just take the first steps.
Nicole said, bring it on. She hopes you're all coming for her. She wants the competition.
Well, and that's fun too, is you because you can kind of keep track of each other, especially if you guys are step challenges, which I want to talk about the National Step Challenge, because that's something exciting we have going on. And you guys can absolutely, so let's talk about the ways that you can upload your biometrics, because you heard me mention the primary care physician example. That's a good example of going, because your primary care, they'll run it through your insurance and you'll get a free preventive care screening. We do have a form you can take with you to your doctor's office if you also want to upload that to GO365, which I definitely recommend. And there's a question of, I'm getting my BMI checked elsewhere, like the gym. Yes, absolutely. You can upload those numbers to GO365. So this form might be a great suggestion. Downloadable through go365.com. And actually, I'll scoot over to the next page, because this is a little screen grab from my personal Go365 account. And you see the biometric screening PDF is right there. So you can download that. We do, Humana and Go365 have partnered vendors. If you go through our vendors, just please note that you're not on the Humana medical coverage. So there may be a fee assessed. But if you are okay with that and you just want to go get your health screening, you can go to any of our partnered vendors. We have tons across the nation. I know you guys are all spread out everywhere. Go through our website. So you see that you can either get a walk-in voucher. If it doesn't say walk-in voucher, we don't need a voucher, but do schedule your appointment through our website here. So go onto your go365.com personal account, go to the activities, biometrics section. So it's very intuitive. You can get there easy. So you have options. You can go and get your own through your healthcare and upload your results to us, or you can go to any of our partnered vendors and they will automatically submit your results to Go365. So there are some options there.
Wow. So
we're going to talk about fitness real quick, because that is the predominant way that people earn points on a regular basis. Because the health assessment and the biometrics, those are once a year activities. So, we don't want you going getting pricked in the finger, 20 times a year. But logging a verified workout is a great way to earn on a regular basis. And it's the more fun way, I think, because again, no matter where you're at, if you're somebody who, here I've been sitting remotely in my chair all day, all morning, I'm not getting a lot of activity during the day, but I can still earn points for whatever sort of activity I am getting. So steps, you heard me mention that's my favorite way to earn points. 1 point for every 1,000 steps you walk. You are for sure walking at least a few thousand steps a day, no matter how little activity you feel like you get. And again, you can simply connect your fitness device or a partner mobile app. We have a lot of them. Heart rate monitors, you can get points for measuring your heart rate, for calorie burn. We have those virtual fitness facilities that I talked about, or the in-person. And finally, we added where you can submit photo proof of your at-home workout. Someone who a lot of times just does yoga and meditation as my workout for the day, I'm not getting my heart rate up doing that. The opposite, as a matter of fact, and I'm not walking around. So great way to show that I'm working out at home is just submit a photo of my yoga mat. A photo of something, your personal gym set. You guys have a gym on site?
We have a gym in our home office, yes, but we also offer free virtual classes through our EPM Fit initiative that we have. So every night at 7 p.m. Eastern, we have a free 45-minute virtual workout. It is a HIIT workout, but so that's wonderful. So you could just, if you're on that, Liz, I know Liz is on there, and a few other, John Crane and Sarah Rodriguez and Hank, they're all on there a lot. You could just take a picture of your screen, I'm sure.
Yes, exactly.
And then submit that, and then you get points for participating in that.
Definitely do that. And Blaine, remind me to talk to you about the gym that you guys have on site. We could maybe get that set up so
perfect.
Points would be easier to accumulate.
Cool.
So connect your stuff to get verified workouts. You get bonus points every time you participate and hit certain goals. So definitely check that out. And we talked about how you only get one per day, but you'll get whatever's higher. So you can absolutely connect multiple fitness devices or mobile apps. And I believe.
So like, that's what you're saying. So if you took 20,000 steps, and that would be 20 points versus a 10 points for the workout.
Correct.
Okay.
Right. Like the gym. Yeah. So the at-home workout or going to a gym or doing a virtual fitness class is a straight 10 points. But things like heart rate, calorie burn, steps, those are higher points based on, longer length of time that your heart rate was up or higher quantity of steps, things like that. Here is a listing of our compatible fitness devices. So these physical fitness devices, we have several. Fitbit and Garmin are usually the most popular options that our members use in terms of what they track. You do not need to have a fitness device to participate in this program. We have downloadable free mobile apps. If you have an iPhone, if you have an Android, you already have a Samsung Health or an Apple Health, and at minimum, you could be tracking steps. So connect some of our apps and notice that our apps aren't just fitness based. We've got like the My Life, which is one of my personal favorites. It's a guided meditation app. It's really cool app. So I would highly encourage you to check that out as well. Write that one down. Okay, National Step Challenge. I've been teasing you guys this whole time. Let's talk about that. Again, going today. You probably hopefully came across it already. If you
we sent it out last week in preparation for this. So we sent it out on our Teams channel. So if you want to learn a little bit about that outside of this, just go into your Teams channel for your office, type in Step Challenge, it'll bring it up there.
Perfect. Thank you. I was going to say, I think that you guys already promoted it because enrollment ends on Sunday, the 26th. So sign up.
2 days away.
It's a few days away. It's been going on for a few weeks, which is why we wanted to go ahead and get the message out as soon as we could. But the enrollment program is going on, time frame is going on right now. So sign up for that challenge. All of you will be competing as an EPM team. So you'll be competing against all of our other teams nationwide. You'll automatically be, and actually I'll show you what it looks like. And all of the winners are going to get meals donated to their local Feeding America. And you guys are my community, so I'm counting on you.
I just love that donation. I'm sorry, that donation makes me happy, but we're getting close to the end of our hour, so I'm going to stop talking.
Right, I know. I just wanted to, here's just kind of all the details about the program. I'll send out this deck for you guys to reference. I wanted to show the dates. So enrollment's almost over, so enroll. And the challenge actually begins on October 4th, and it'll run for about a month. So we'll be figuring out who all the winners are later on this year. And you can get up to 35,000 steps per day. So go ahead and get your fitness devices connected over the weekend.
Don't cheat.
Yes, try not to cheat. Sometimes I noticed even clapping my hands, I get steps. So
yeah.
Sometimes it's hard not to.
Don't put it on one of those shake weights and,
It's super simple to join. So just open up your GO365 mobile app and you can find the challenges. So super simple to join, and you'll be able to see how many steps your coworkers are getting as well. So you can kind of encourage each other to keep going. And we went over how you would kind of connect your devices, but here's just a kind of recap. You can reference this later. Okay, so we're here at the end. I know I have this long deck that I'm kind of flying through, but tons of ways to participate. So make sure that you're checking out both the mobile app and the website for all of those different opportunities.
I'm sorry, We had, it says CPR certification under education. We actually, a few months back, or I don't remember when time, we had a CPR certification class for this. So some people were
That's great.
certified and could upload that. Yeah.
Upload that to the mobile app. That's the easiest way to upload it. And that's one of the things, I'm so glad you mentioned that actually, because that's something that's exempt the 90-day window. So go ahead and key in sometime within 90 days. So it goes through, but those certifications are good for 2 years. So go ahead and get that uploaded. Absolutely. But aside from that, we talked about the health coaching already. So check out your mobile app for that. Check out the meditation and mindfulness opportunities as well. And here we are, we're at the resources. So I am going to make sure that you guys make sure you update your contact information so that we are correctly communicating with you. Here's the community that we talked about. So let me actually cue that in the chat here. And pasted when we get to the end. So we'll make sure you guys have the community, how to get to the community and stay on top of any updates, any videos, things like that.
I was gonna say, Nicole, you should screenshot this.
Yeah, I was gonna say, if you haven't already, go ahead. Check out the GO365 YouTube channel. Just go to your YouTube and key in GO365. We have tons of videos that we are constantly updating. Right now, the step challenge is going on, so you see a lot of those. And there are those numbers I promised you. So please put those in your phone.
Customer support. I'm writing it down. See my pen.
So I know that I spent a lot of time talking. I hope that we answered a lot of your questions as we were going along, but
does anybody have any questions? Put in the chat real quick as we wrap up here for this Empower Hour on September 24th. Thank you so much, Laura, for being here while we let people type in their questions if they have any. I just want to say thank you again for being here. That was super informative. And also thank you for having personality.
Thank you. No, I'm so thankful to be here. I'm glad that you guys are in a place where you're able to kind of have this time with us. I hope to be able to talk to you guys all again, especially as the renewal time comes up. So, you know, best of luck with using everything. I hope that you guys, that I start seeing a lot of improvement in terms of the status levels. So I'm looking forward to helping you guys however I can. I'm honored to be here today.
Thank you. We'll probably do this again, and we'll probably do this again in a few months just for the new employees who come on. So we'll see you again, Laura. I will see you again. And it doesn't look like anybody's got any questions. So until next Friday, y'all have a wonderful week. And Laura, thank you so much for being here today. This has been Empower Hour Live. Bye, y'all.